Good morning to all. Welcome you all in ISFCP dialogue series under the aegis of IQAC-IIC ISFCP, organized by ISF College of Pharmacy and Autonomous College, Moga, Punjab. Today's guest and speaker, Ms. Navjot Kaur Sandhu, Assistant Professor in Department of Pharmaceutics, and title of her talk is Role of Pharmacist in Hospital and Hospital Pharmacy. We welcome you, ma'am. Please proceed.
Thank you so much, sir, for the introduction. Good morning, everyone. Myself, Navjot Kaur Sandhu, Assistant Professor at ISF College of Pharmacy in the Department of Pharmaceutics. So, moving towards the topic, the title of my talk is Role of Pharmacist in Hospital and Hospital Pharmacy. So, here are the contents of my talk. First, we will discuss about journal about the definition of hospital and hospital pharmacy, as the pharmacists are involved in hospital as well as in the hospital pharmacy. So we will also discuss about who are pharmacists and what are their role to play. Next, we will discuss about the hospital pharmacy and DDS. DDS here means drug distribution system. In this, we will discuss about different categories of drug distribution system. Also, the services those are given by the pharmacist to outpatient, inpatient, and what are the other requirements with respect to hospital pharmacy. Next, we will discuss about the skills to become a pharmacist. Next, duties of hospital pharmacist means which type of responsibilities they have to play, what are their duties. And last, we will discuss about the career options for pharmacist means what other options they have except the pharmacist. So first topic is definition of hospital. As we know, in simple terms, we can say hospital is a home for sick people from where they can come for the treatment for minor illness or for the major illness. So we can say hospital is a type of institute which belongs to a community health, where there are different type of healthcare providers like physician, surgeon, and a team of technical staff for other works. So hospital, as we know, hospital provide the basic facilities like for the diagnosis, therapy, prevention, even for the education and for different type of research purposes. Mainly nowadays hospital mainly focus on the preventing measure of any disease, means how we can prevent any disease so that it should not सो दैट ताकि वो डिजीज़ है वो आगे किसी को फर्दर ज़्यादा ना हो, उसको हम कैसे प्रिवेंट कर सकते हैं. नेक्स्ट इज द हॉस्पिटल फार्मेसी. एज वी नो हॉस्पिटल क्या है, एक हमने पढ़ा है कि हॉस्पिटल क्या है, एक इंस्टीट्यूट है, पार्ट है कम्युनिटी हेल्थ का. तो हॉस्पिटल फार्मेसी इज व्हाट, हॉस्पिटल फार्मेसी क्या, इट इज़ अ डिपार्टमेंट इन हॉस्पिटल. क्या क्या प्रोसेस होते हैं वहाँ पे, लाइक द प्रोक्योरमेंट, स्टोरेज, कंपाउंडिंग, डिस्पेंसिंग, मैन्युफैक्चरिंग, टेस्टिंग, पैकेजिंग एंड डिस्ट्रीब्यूशन ऑफ ड्रग. मीन्स जितने भी ड्रग रिलेटेड है, हम कि हमने ड्रग कैसे प्रोक्योर करनी है, कहाँ से हमने बाय करनी है, ड्रग को हम कैसे स्टोर करके रख सकते हैं, उसकी कंपाउंडिंग कैसे होगी, कौन कौन से पेशेंट को हम लोगों ने डिस्पेंस करनी है, मैन्युफैक्चरिंग के क्या प्रोसेस होंगे, उनके डिफरेंट टेस्टिंग के क्या पैरामीटर्स हैं, ड्रग की पैकेजिंग कैसे होगी, और ऑन द रिक्वेस्ट कौन कौन से डिपार्टमेंट्स को हम लोगों ने ड्रग्स डिस्ट्रीब्यूट करनी है. अलॉन्ग विद इट हॉस्पिटल फार्मेसी जो है वो किसके साथ कंसर्न करती है, एजुकेशन और रिसर्च, मेनली विद रिस्पेक्ट टू फार्मास्यूटिकल सर्विसेज. और जो हॉस्पिटल फार्मेसी है विच इज़ कंट्रोल्ड बाय अ प्रोफेशनली competent and qualified pharmacist. Now who are pharmacists? Pharmacists क्या है, these are like a medical expert जो क्या है हेल्प करते हैं पेशेंट की, सो दैट दे कैन अंडरस्टैंड देयर मेडिकेशन, दैट व्हेन दे विल हैव टू टेक देयर मेडिकेशन, व्हाट कैन बी द potential reaction, or we can overall say that pharmacists are the medical expert who mainly counsel the patient, that is patient counseling. They will counsel the patient with respect to their medication, disease, treatment. They will answer their every type of queries. And these are pharmacists are the professionals which are having a, as they are having a depth knowledge of composition of medication, including even their physical and chemical properties. Pharmacists also take part in clinical trials and in research process, so that they can find out how these medication affect the human body. Means जो मेडिकेशन प्रोसेस में है उनका ह्यूमन बॉडी पे क्या इफेक्ट हो रहा है, अगर उनका कोई एडीआर हो रहा है, एडवर्स रिएक्शंस हो रही हैं बॉडी पे, उसको कैसे प्रिवेंट करना है, कोई भी ड्रग रिलेटेड इंफेक्शन हो रही है, तो इन सब चीज़ों के लिए दे ऑल्सो take part in or take participate in different clinical trials as well as in the different type of research processes. Now we will discuss about the hospital pharmacy and drug distribution system. the basic services which is provided by a hospital pharmacy department, and it is a major type of services which is known as drug distribution. So mainly drug distribution is of three categories. First one is ward control system. The other name of this type of system is ward basket system. Second is pharmacy controlled impressed based system, and third is pharmacy controlled patient issue system. So these are the three different type of drug distribution system categories, as this is main services which is provided by the hospital pharmacy. So first category is ward control system. So the other name of this type of category is ward basket system. In this category, what happened? The ward writes an order to the pharmacy so that they can fulfill the order and assembles the order as per the requirement given by a particular ward, and they will collect all the medication and refill them. Even they will refill the medication. Mainly, this system is mainly occur in or seen in a public hospital. So the second category, second in the second category, there are definite range of drugs or some number of drugs which are already available in each ward, and it is a responsibility of a pharmacy staff or the pharmacist that they will manage the number of drugs which must be available in the each ward. And this is mainly used for inpatient. Inpatient means those patients who are admitted in the hospital for the major treatment. And the third category is pharmacy controlled patient issue system. In this system, the instead of issuing any number of medication to the patient to the ward, the medications are directly issued to the patient. And this type of classes are also known as unit dose system, because in unit dose system, only the acquired number or the required number of medication are issued to the patient as per the prescription written by the doctor or according to the doctor's instructions. So next we will discuss about the outpatient services. In second part in drug distribution in a hospital pharmacy, major is outpatient. Outpatients are those patients who do not occupy any bed in a hospital, not in a hospital, even in the clinics or in the healthcare system. So the main department which is associated with these type of services is known as OPD, which is outpatient department. In this, the patient with a common illness or minor illness, they will go to the OPD, they will consult their physician about the illness, and they will take their medication from the pharmacy, and they will go back. And this the in this outpatient system, the prescription will be sent to the pharmacist, which is really written by the physician, and he will pharmacist will dispense the medication as per the instruction. So in this also, pharmacist will also calculate the price, means number of medication written by the doctor for the patient. On that basis only, he will calculate the price is, and pharmacist will hand over all the medication and all the other materials to the patient. And pharmacist will also instruct the patient, means he will do the counseling of a patient with respect to the medication. He will counsel them regarding the use of medication, and also provide some time of precautions, that which type of things he will patient have to kept in his mind while taking any type of medication. And next we will discuss about the categories of outpatient. Mainly there are four type of categories with respect to outpatient. First is emergency outpatient. In this, there are emergency outpatient. Emergency means patient those required immediate attention. These include like some type of accidental cases, minor accidental cases, or if we have any tragedy upon these kind of patient include in emergency outpatient. Next is tertiary care. Tertiary care patient, those are directly referred to OPD, means some other doctor has given a reference. So these patients come under a tertiary care who require special treatment. Those not come under the emergency, but these are directly come to the OPD by the attending medical for special treatment. Means when some other physician, मतलब जब कोई other doctor हमें consult करता है कि we have to go to other doctor, these are under the tertiary care outpatient. Next is primary care. Primary care means for the daily personal needs, or those patient who come for routine checkup, or for the health maintenance, or the for management of some minor symptoms, or for the problems. Next, last one is ambulatory patient. Those patients who come for ambulatory patients are mainly type of our primary care patient who come for the consultation purposes, or who has a minor illness. So these are the four categories of outpatient. Next, this is a receipt system which is mainly used in outpatient. What happens in this? In this, first of all, the doctor will write a prescription that pharmacy. After that, the pharmacist will receive a prescription, and according to the doctor prescription, pharmacist will fill the prescription on the basis of three criteria. First, he will select the drugs, means the number of drugs those are written by the doctor on a prescription. Then the pharmacist will label those according to the instructions which are given by the doctor, and according to number of medications, he will price all the medications. And next, after filling of prescription, there are two parts. First one is receipt of payment, second is prescription file. On receipt of patient, we have three parameters. First is free, cash, and charge. Same way, in a prescription file, we have two type of prescription file. First one is regular prescription file, and second one is narcotic prescription file. These files are separately maintained, as narcotics prescription file includes some type of narcotic drugs. Those cannot be issued under the as pharmacist cannot issue those drugs if doctor hasn't mentioned those drugs in a prescription. So those files are separately maintained, and regular prescription files are separately. So this is an overview of a receipt system for outpatient, that pharmacist has to file the prescription, he has to select a drug on the basis of prescription. On the same basis, he has to label the drugs, and he will calculate the price on the basis of drugs he has selected from the pharmacy. Now, discussing about the next, that is inpatient. Inpatient are those patients who require hospitalization, means they get admitted in the hospital for the major illness and stay there till they get discharged. So mainly in a inpatient department, it must be located on the ground floor or first floor of a building, so can it will be easy for the pharmacist or pharmacy professionals to distribute any number of drugs. And even in this also, dispensing is all carried out by the pharmacist only, and the staff which is available, that is skilled as well as a qualified staff. Along with this, it is a multifunctional department, as we can store number of drugs those can be required for dispensing, as well as it is also used for the manufacturing of different types of IV fluids and different type of parenterals. So systems of inpatient. So mainly there are four systems for inpatient. Those require unit dose dispensing system, and ward control system. um, uh, Ward control unit dose dispensing, in this only the number of required dose are distributed to the patient according to the chart made by the doctor. Means जो डॉक्टर ने चार्ट बनाया उसके अकॉर्डिंग ही जो वहाँ पे नर्सिस होंगी वो उसको फुलफिल करेंगी, और दैट टाइम ओनली वो उसी टाइम क्या करेंगी, फार्मासिस्ट से जो भी मेडिकेशन है वो इशू करवाएंगी, वो आएंगी इन पेशेंट में. नेक्स्ट इज बेड साइड फार्मेसी. सो द बेड साइड फार्मेसी में क्या होता है, जो बेड साइड फार्मासिस्ट होता है वो इंटरेक्ट करता है नर्सिंग स्टाफ के साथ और मेडिकल स्टाफ के साथ, क्योंकि बेड साइड फार्मासिस्ट क्या करेगा, उनको नर्सिस को या मेडिकल स्टाफ को गाइड करेगा अबाउट द नंबर ऑफ मेडिकेशंस, कि कौन से टाइम उन्होंने मेडिकेशन डिस्पेंस करनी है, इनकेस कोई इफेक्ट शो हो रहा है एट दैट टाइम कौन कौन से उनको प्रिकॉशंस लेने हैं. और क्या करेगा, ऑल्सो एडवाइस करेगा उनको कि कौन सी नंबर ऑफ ड्रग्स फ्रीक्वेंटली यूज़ होनी है, उनका बॉडी पे क्या एक्शन शो हो सकता है, और इनकेस अगर मल्टीपल ड्रग थेरेपी उस टाइम पे नर्सिस स्टाफ को क्या प्रिकॉशंस लेनी चाहिए जब उन्होंने मेडिकेशंस एडमिनिस्टर करनी है पेशेंट को. तो फार्मासिस्ट ऑल्सो क्या करेंगे, अपनी एक्सपर्टाइज से एवेल्युएशन करेंगे कि जो प्रिस्क्राइब ड्रग्स डॉक्टर ने प्रिस्क्राइब किया, प्रिस्क्रिप्शन पे लिखी है, वो एज पर द ट्रीटमेंट है. इन केस एनी चेंजेस है तो वो डॉक्टर के साथ कंसल्ट करेंगे, अदर हेल्थ केयर मेंबर्स के साथ कंसल्ट करके दे कैन हेल्प इन चेंजिंग द नंबर ऑफ मेडिकेशन. सो द फार्मासिस्ट ऑल्सो act as an important member of professional team for physician and for the healthcare member. सो बेड साइड फार्मासिस्ट क्या है, एसेंशियली इसको हम बोल सकते हैं दैट द बेड साइड फार्मासिस्ट इज अ ड्रग थेरेपी एडवाइजर. बिकॉज वो क्या करता है, उसकी रिस्पॉन्सिबिलिटी होती है कि जो भी मेडिकेशन प्रोवाइड की हैं, जो भी नंबर ऑफ मेडिकेशन फार्मासिस्ट डॉक्टर प्रिस्क्राइब कर रहा है, वो एज पर द ट्रीटमेंट हो, उसका बॉडी के ऊपर कोई एलर्जिक रिएक्शन ना शो कर रही हो, कोई बॉडी के ऊपर एरिया ना शो करे. तो सो दैट्स व्हाई वी कैन से द फार्मासिस्ट इज एसेंशियली एक्ट एज अ ड्रग थेरेपी एडवाइजर, वो क्या करेगा, ऑल्सो गाइड करेगा पेशेंट को अबाउट द ट्रीटमेंट की हाउ मच टाइम द पेशेंट हैड टू कंटिन्यू हिज ट्रीटमेंट एंड व्हाट आर द at that time the patient will get discharged, and how the patient after getting the discharge, how patient had to take their medication, what is the storage condition for the medication at home, and if we have skipped any number of doses at that time, the patient do not have to take stress or do not panic. He can consult a doctor or physician, or can take help from the by advice taking help from the pharmacist also. So these are the, now we will discuss about the personal requirement in hospital and hospital pharmacy. So this is the basic layout. First of all, there is will be one administrator. Under administrator, there will be a head of pharmacy services. The qualification of pharmacy services must be of M.Com, and after that, there are five main pharmacists. Those are required. First one is the dispensing chemist, and the qualification of dispensing chemist must be D.Pharm, and it will act as a dispensing chemist for both inpatient as well as for the outpatient. Like the second one will be the manufacturing chemist, and the qualification for manufacturing chemist will be M form, and he will took participate in two departments. First will be in the manufacturing of IV fluid, and the qualification can be either B form or M form. Next one is other than IV fluid, that is other type of manufacturing, like other type of dosage form, that can be solid, liquid, semi-solid. For that, the qualification of pharmacist must be B Pharm. Next is a clinical pharmacist. Clinical pharmacist qualification must be B Pharm. Next is quality control pharmacist for checking of drugs or for the testing of different type of formulations. The qualification of that will be M Pharm. And last one will be the medical store pharmacist. Medical store pharmacist means who will maintain all records of the pharmacist. The qualification will be D form or B form, because he will check all the medication, he will check the order, as well as help in maintaining the inventory control, means he help in maintaining the stock management system of the pharmacy. Then this is the requirement of pharmacist on the basis of bed strength, means as the number of bed strength are increasing, the number of pharmacists are also increasing. If we having a number of bed up to 50, the pharmacist required would be 3, and as we can say second category is up to 100 beds, the number of pharmacists required are 5. If number of next up to 200 bed, the pharmacists required are 8. Next up to 100 bed, the pharmacists required are 10. Next, if the bed strength is up to 500, then the number of pharmacists required in a hospital and in a hospital pharmacy is up to 15, because as the number of beds are increasing, the number of pharmacists required in a hospitals also get increased, as these both are directly proportional to each other. So next is the qualification required to be a pharmacist. For the minimum, we will discuss from the minimum. The minimum qualification required to become a pharmacist is diploma in pharmacy with the hospital training, which is about of 300 hours. Next can be a bachelor in pharmacy from the affiliated institute. He must have a registration from the PCI. Next is masters in pharmacy, and mainly specialization includes in this is specialization in pharmacy, pharmaceutics, or pharmacy practice, because those who have done masters in pharmacy and gone to a pharmacist, they act as a manufacturing chemist, or we can say the quality control pharmacist in different departments. Next is the requirement of hospital pharmacist on the qualification basis. The head of the department will be a director, under which there will be a superintendent for the pharmaceutical services, under which there are four different categories. First one will be the drug distribution department. First department, the pharmacist qualification must be before, means the pharmacist who will distribute the drugs to different department according to the requirement or as per the order written by the nurses. So the that person qualification must be a B form. Second one is medical store pharmacist. The medicals, as we have discussed, the qualification of medical store pharmacist, it can be a D form or B form, as he or she has to maintain the proper records of the medical store, and he has to store the drugs according to their specification, and also have to manage the stock, and refilling of a stock is also a responsibility of medical store pharmacist. Next, we two pharmacists for dispensing of medication, means when the doctor will write a prescription and patient will go to the pharmacy, at that time pharmacists had to dispense the medication as per the written order. So the qualification of those pharmacists must be B Pharm or M Pharm, as they act as a dispensing pharmacist. And then last one for the pharmacist for the quality control, means for testing purposes, and for that the pharmacist must be a postgraduate, because he has to check the quality of different type of medications. Next is skills to become a pharmacist. So many, there are four type of skills. First one is detail oriented, means pharmacist must have a complete detail of every type of a drug, and it is important for the pharmacist that he must follow the prescriptions carefully, so that he can give proper advice to the patient regarding the medication, that when they have to take different type of doses from, when they have to consume different type of medication, if there are any effect occurring on their body, what precautions they have to take, and whom they have to consult about any type of reaction if they are seeing in anybody. So pharmacist must have a complete knowledge about every type of a drug, starting from the drug dose till any type of, if any type of contraindication is occurring, or if any drug interactions are occurring on a body. Next, the pharmacist must have an analytical thinking, means he must understand the patient health requirement, he must understand that which type of medications doctor has prescribed. According to those, the pharmacist will counsel the patient, so that he can help the patient, so that they can take their medication safely and follow every type of a drug chart. And medication adherence must be properly followed. If they will not follow the compliance with respect to the doctor need, they can face many type of problems, why which can deteriorate their health also. Next is communication skills. It is the most important part of important skill that a pharmacist must have, because if we having a good communication skills, we can easily explain our ideas, reviews to anyone, so that they can easily understand. Not only in a language, we can communicate with others in a simple language, or in a language in which we can easily convey our message, so that other can easily understand what one is going to speak. It can be communication skills, can be we can make some ideas, or we can using a writing also, we can understand anyone that what we are going. So pharmacist, as pharmacist, has to interact with the patient, not with the single patient, with multiple number of patient. Also pharmacist has to communicate with the physician when in a collaboration. So having a good communication skills will help the pharmacist to counsel the patient properly, and it will also create a good relationship among the parents and even the members, those are accompanying with the patient. And it will help the pharmacist to maintain a good interprofessional relationship and intraprofessional relationship with the other healthcare professionals also. So communication skills are the major and most important skill that a pharmacist must have. And the last important skill, that is computer literacy. As we know, nowadays everything is working on a computer. So pharmacist job also require computer literate persons, because now we have to manage every type of a data using a computer. He must know the basic task or basic understanding of different type of computer, different type of computer softwares, or different type of platforms which are going to use on computer. Because starting from a preparation of prescription, starting from a first step till entering every data of a patient, either for the inpatient or for the outpatient, everything is now computerized. So the pharmacist must have a thorough knowledge of a computer, that which type of data we have to add on a computer, how we have to save those type of data, how we have to control the inventory, in which we can check also about our stock management, that how much data we have, sorry, how much medications we have ordered, and how much we have received, at what time we have to again do the inventory, or for the restocking of any material. And mainly in case of inpatient, we have to add all data to the computer, starting from the date of admission, means on which date the patient has admitted in the hospital, what are the conditions for admitting in the hospital, what are different type of treatments which patient is undergoing, how he is recovering, all the process with respect to inpatient and outpatient, every data for patient as well as for the medical store, everything is now recorded on the computer. So a pharmacist must have a thorough knowledge of the computer also. Next, these are the some responsibilities of a pharmacist, that there are mainly five major responsibilities of pharmacist which pharmacist has to play. First one is reviewing prescription. As we know, the main duty of pharmacist is to review prescription before dispensing medication, before issuing a medication to the patient. Pharmacist must review the prescription thoroughly, so that if he is having any issue in this, or if he is not understanding any medication written by the doctor, he can directly consult with the doctor before issuing the medication. So that right number of drugs can be dispensed to the patient to improve their health. So also to minimize or to pharmacists think there are a large number of medication, the pharmacy patient could not consume this type of medication due to some severe problem. So the pharmacist can alternate these type of medications by consulting with the doctor. Second is the communicate with the prescribers. Means pharmacist must be equipped to that how he will educate the patient. They will understand about the clear meaning of medication, that the number of medications those are provided by the prescriber, how patient have to consume it. He will, if we think anything has to be changed, he will discuss with the doctor to provide some alternative or change in doses. From sometimes the alternatives are not possible, so at that time what will pharmacist form of medication in. So next one is ensure health and safety. As it is a responsibility of pharmacists to dispense correct number of medications. So before dispensing, he must firstly review the patient medication history, because sometimes there are chances of multiple drug therapy. At that time, the number of reactions may increase. So, what will pharmacist do? He will check the medication history before up to date information of every patient, that how many number of patients are visiting recently, how many patients are visiting regularly, what is their health condition, how much treatment they require more. So these are the number of things that pharmacist is responsible, that he will ensure. It is an essential part for pharmacist to ensure the health and safety of every patient. Next one is counsel patient. Matlab he will do the counseling of a patient, starting from the patient treatment till how much medication he have to take. For everything he will counsel the patient regarding the number of drugs, that how many drugs you have to take with the food, and if they are not taking any number of medication, what effect they can have on the body. They will also, if they are having some major problem, they will recommend that they can take some non-prescription drugs, those are like vitamin. He will help them to maintain a healthy diet, do some exercise, or will help them to suggest to some dietitian if they are having a major some other type of major issues. And if any patient is having any problem in doses form, or if any patient cannot adhere to the large doses, so the patient counseling, at that time the patient counseling also done by the pharmacy. Next, the pharmacist will also perform some type of administrative task, that is with respect to maintaining of records, stock management, means organizing different type of patient data, conducting different type of services, so that it could be helpful for the pharmacist to increase their knowledge. And they will also ensure about the quality, security, and proper disposal of different type of pharmaceuticals, that how they have to place the order, what could be the receiving procedure for different type of pharmaceutical, how they have to store different type of drugs according to their storage condition, what could be the labeling procedure after receiving different type of medication, what are the different type of compliance and non-compliance policies, those are guided with different type of pharmaceuticals. Next is the duties of a hospital pharmacist. As we know, pharmacy is a profession that involves preparing and dispensing of medical drugs. So we can say pharmacists are the healthcare professional who guide the people with respect to different type of medication. Even they conduct research on different medicine, those help in improving the patient care. And the hospital pharmacists provide services like of leadership, management, and consultancy to the healthcare team in different aspect of pharmaceutical care. And the hospital pharmacist duties also include patient education, managing different type of medication system, risk analysis with respect to different drugs, so that they can achieve the best outcome for the, even for the outpatient as well as for the inpatient. So these are the career options for the pharmacist. So the first option will be related to the retail pharmacy. As we know, there are a number of pharmacists who often work at retail stores. So apart from prescribing prescription and non-prescription drug, pharmacists also help in maintaining the keeping accounts open, supervising sales, keeping different type of track of supplies, means how they can order different type of a drug. Even they also provide guidance on health issues, symptoms, medication for customers upon inquiry. Matlab if any person is having different type of inquiry with respect to any drug, so they can counsel the patient according to their need. Next one is, as we know about the hospital pharmacy. As we know, hospitals need different as hospital need pharmacists as well as the pharmacists, so they can assist the doctors in preparation of number of medication for the patient. And pharmacists, as we know, pharmacists play an important role in different type of system, like determining the drug, how to manage different type of a drug with the suitable treatment for monitoring the effect of a drug. They will also regularly monitor supplies, and they will also prevent the shortage, and they will also maintain the stock. Next, the hospital pharmacist or the pharmacist play a role in research and development also, as these professionals can find lucrative careers. Means these type of careers are those are having a greater benefit for the research persons as well as for the institute for which the research, at where the research is carried out. So to get into research, they first must complete their bachelor degree. As pharmacy students, they devote their careers, they create new drugs and research different type of new facts. And furthermore, they collaborate with other experts in other fields, in which we can say they collaborate. They must have a interprofessional and intra-professional collaboration with other departments also. Next one is next career option for hospital pharmacists. They can act as a medication. They can work in a medication distribution center, where pharmacists engage in a central process, because there are large number of orders. Those are given by different companies, different hospital and healthcare facilities, and they also conduct same the work. Their work is to check the inventory and place the orders and distribute the order as per the requirement, as the order is given by different companies, hospitals, and different healthcare facilities. So next one in the government sector, a pharmacist, those are working in government sector, is also responsible for health and safety for different type of citizens, or for the different type of persons who are working in different sectors, like in a pharmaceutical companies, in different type of hospitals, or in other healthcare centers. So they must provide a certain certification, so that they can ensure the proper number of drugs are prescribed to the patient. And they must develop a new medicinal drug for the public, which have a vital role to play, from which for which the pharmacist plays the important role. Next one is the hospital pharmacist plays role in military services also, as pharmacists are working for the military, as they provide medication and treatment to the enlisted number of members. Means that those members, those are enlisted by the military. So for working as a military hospital pharmacist, one must have to undergo a basic military training, so that they can understand about each and every regulation of a military, because rules may differ from one place to other place, or they may, while traveling, the hospital pharmacists help the military persons, as their service is quite active, and they provide the basic services once told by the physician to the hospital pharmacist. Thank you everyone.
Hello, Navjot ma'am.
Sir.
Yes. So you successfully completed, ma'am.
Yes sir.
Yes. Yes. So we are very thankful to Navjot ma'am for his excellent talk on role of pharmacists in health community. And we are very thankful to all listeners for their precious time. If you have any query, please mail in the chat box of YouTube, and please visit our website www.isfcp.org. Thank you, Navjot ma'am. Thank you so much.
Thank you, sir.